Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. This is a series of lectures on your heart. The feature presentation is Obesity is much more serious than just a few extra pounds in the front, on the sides, or everywhere. We're going to look at some of the long term effects of obesity on various systems in the body and how we can reverse those changes with simple steps. So let us begin with the feature presentation. I'm going to switch over to the full screen PowerPoint presentation so we can focus on the topic. Here's a chart showing the ideal weight for women and men. Let's take, for example, a lady who is 5 feet 5 inches. The medium size weight should be between 127 pounds to 141, and a male 5 feet 7 inch average, the weight should be maximum 163 pounds, or if it's a large frame, 180 pounds. It doesn't take a whole lot for a person to go from a small frame to a large frame, because most of the remaining, what I would say, 35 pounds are going to be made up of fat. That's what leads to obesity. What is obesity anyway? How do we define obesity? Who is overweight? Who is obese? Who is morbidly obese? To answer that question, here we have this body mass index. I'm going to show you in the next slide how to calculate the body mass index. You can follow my arrow here. The body mass index between 16 to 18.5 is underweight. So that's also a problem if you're underweight. There are some people who can eat everything under the sun and they don't gain weight. Blessed are those people. The normal body weight is where the BMI is between 18.5 to 24.9. Between 25 and 30, you are overweight. I'll tell you how to calculate that. Between 30 and 39, it is obesity, and beyond 40 is considered extremely obese. Let us look at and see how we calculate our body mass index. If the height is 152 centimeters, that is 1.52 meters. So we need to square the height. So that is 1.52 times 2, that will be 2.31 meters square. Then you simply take the weight in kgs. If the weight is 60 kilograms, 60 divided by 2.31 will give you a body mass index of 25.96, which is just edging into overweight. The normal BMI is between 18.5 to 24.95, so you are getting into slightly obese or overweight section. Here's a chart which kind of emphasizes not only what BMI is important, but also how our body shapes would look if we continue to go from a normal BMI to overweight. And we may not think we are that overweight, and a few years later we realize we are actually obese. And when we lose control of what we are supposed to be doing, it doesn't take a whole lot to get into morbidly obese condition. But the problem with obesity, just like arterial disease, like diabetes or hypertension, it affects every other system in the body. Surprisingly, obesity affects every system in the body, starting with the central nervous system, emotional, psychological system, lungs, heart, stomach, sugar, sexual organs, both in men and women, lipids, that is talking about cholesterol and triglycerides, and it causes polycystic ovaries, osteoarthritis. This is just a limited list of some of the things that can go wrong with overweight to morbidly obese person. You may not experience all of these at the same time, but as the weight continues to grow, all these symptoms are going to become pretty prominent. I'm going to highlight on some of these symptoms. So if you are having these symptoms, that should be a signal that your obesity is not only just a few more extra pounds, but it is taking toll on every system in your body. So let us look at each one of these and try to understand as how obesity affects all these systems and how we can reverse these changes with very modest reduction in the body weight. Let's start off with the lifespan. If you're obese, your lifespan is cut depending upon your age. If you're obese at age 20 to 39, that's early obesity. I was giving a presentation about heart to the middle school students. Can you imagine almost 30 to 40% of the elementary school and middle school children are overweight? I mean, that's an astronomical number. But that's what the reality is. The adult population between the ages of 60 and 79, almost 40 to 50% of the people are overweight or moderately obese. If you're overweight in the ages between 29 and 39, 20 to 39 years, your longevity if it is cut down by 6 years. If your BMI is between 30 and 35. If your BMI is greater than 35, then it is cut down by 8 years. You just take a look at this chart and see where you fall and how it's taking an effect on your longevity. Just to top off, next, metabolic syndrome. Well, people with obesity have high blood glucose levels, they have high cholesterol levels, they have high triglyceride levels, and they are at an increased risk for cardiovascular diseases. The good thing is, just by losing 2.5 to 3%, 10% can prevent you from getting diabetes if you are already in this what is called metabolic syndrome, where there is high calorie intake, there is borderline blood sugar, not quite diabetes, but borderline blood sugar, elevated triglyceride levels, and elevated inflammatory markers. And these are the things that will say, okay, you are tipping in the wrong direction. I mean, your scale is, but you are also tripping in the wrong direction. And that's the time to take charge. And let's take, for example, if you are a person who is 300 pounds, throughout this example for illustration purpose. If you lose like 10%, 30 pounds, which is not an impossible task, then you can reverse the development of diabetes. Let's move on. But if you already have diabetes, and if you are taking medications, and if you are moderately obese, just losing 2.5 to 15% of your weight can drastically reduce your insulin requirements. Think about that. You're losing your weight, you're mobilizing your sugar better, you're bringing your blood sugar better, so you're going to need less and less medicines. Because every time you increase your insulin, you're increasing your fat buildup in your body. So it is a vicious cycle. You build up more weight, you eat more, then you take more insulin, so you build up more fat, and it becomes a vicious cycle. It is a never-ending cycle which we need to reverse it. And the best way to reverse it is to lose weight that brings down the insulin requirements, and thus it reverses the direction in which our body is moving, and hopefully that will help you to minimize some of these conditions. Next, most people don't think about the effect of obesity on the central nervous system, but depression is a common complication of obesity. If you are having mood changes, changes in appetite, sleep disturbances, agitation, fatigue, difficulty in concentrating, and you are not able to sleep better, these may be symptoms of depression. which might have been related to your obesity. So just don't try to ignore these symptoms and just think it is just a process of getting older. No, that is not true. The good news is by losing 10% of your body weight, you can prevent the development of depression. Because when you start doing positive things like reducing your calorie intake, burning fat, I have a separate video on how to burn fat faster. Please watch that one. That will tell you how you can burn fat. There are only two basic principles involved in weight loss, which I'm going to tell you at the end of the presentation. And I have done that and have proved it for myself. Okay, let's move on. Stomach problems. Stomach problems are a very significant issue with obesity, especially with overweight and morbidly obese people. Why is it? Because of the abdominal pressure, increase in abdominal pressure, the stomach is pushed into the chest, resulting in an acid reflux into the lower esophagus, which leads to GERD or gastroesophageal reflux disease. The acid regurgitates into the lower end of the food pipe, which gets inflamed, leading to heartburn, pain, epigastric pain, and spasms. The other symptoms that you may experience with GERD is heartburn, regurgitation of sour acidic liquid in your mouth, persistent cough, because when you're sleeping, the acid gets into your oropharyngeal area and some of it may trickle into the airways, causing persistent cough, throat discomfort, difficulty in breathing because of obesity, and bad breath, and of course chest pain related to heartburn resulting from the acid reflux in the lower end of, and sometimes because of the increased pressure, you can also get what's called hiatal hernia, where a part of the stomach bulges into the chest. It presses the heart, leading to pain, chest pain, which can mimic heart disease. Liver, along with the effect on the central nervous system and the lungs and all these things, liver is an important organ which is affected by the obesity. In obesity, there is deposition of these fat cells in the liver parenchyma, like these lighter spots, which replaces the actual liver tissue with these fatty tissues. And the accumulation of this fatty tissue, as you can see, all these empty spaces of fat cells. And when these fat cells replace the actual liver cells, then you have an issue. It's going to lead to non-functioning liver. It is kind of a cirrhosis. The sad news is 50 to 90% of the obese people have non-alcoholic fatty liver disease compared to 15 to 30% in the general population. But if you just lose 10% of your weight, you can significantly improve the amount of fat content in your liver. Liver is an important organ which is involved in the production of glucose, all the proteins and enzymes. So you want to protect your liver at all costs. Obesity can also lead to infertility, but a modest reduction in weight, like 5%. So if you're 300 pounds, if you lose like 15, 20 pounds, that can improve your ovulatory cycle. That's the menstrual cycles can be better regulated if you lose weight. Let's look at obesity and its effect on men. Because of it is a physical disorder and it becomes a hormonal disorder, all of this can lead to erectile dysfunction and subfertility in men. Obesity also restricts your ability to perform because of excess weight. The CDC put out this chart saying that 13 types of cancers are associated with overweight and obesity, starting with meningioma, adenocarcinoma, multiple myeloma, kidney tumors, uterine tumors, ovarian, polycystic ovary and ovarian cancer, stomach cancer, gallbladder, liver, breast cancer, thyroid, colon. All of these can be having an increased incidence in obese people. The best thing is to get your weight down. And obese people also have this very common problem, that is obstructive sleep apnea. They can't breathe when they sleep. Because of obesity, their chest expansion is limited. They also have obstructions in the upper airways, and you have seen many people have to use this CPAP at night just to breathe because of the obstructive sleep apnea. They develop periods of no respirations, and that leads to reduced oxygen levels that can have an effect on the brain function. To half of the adults who are obese have this obstructive sleep apnea, but again, a modest 10% reduction can significantly improve your sleep apnea, and you may be able to minimize the use of these devices, which are extremely uncomfortable to wear over a protracted period of time. Next, obesity leads to liver dysfunction, which leads to accumulation of extra triglycerides, the fatty acids coming from the diet. They are all converted into VLDL and LDL, bad cholesterol. The good cholesterol is reduced. The apoprotein A is also reduced. So the overall lipid profile is just going haywire. So it looks like everything is working in the wrong direction as you continue to gain more and more weight. The good news is, by reducing the weight, you can reverse these changes. You can remove a lot of those fat cells from the liver and restore some of the liver function. So you can reverse these lipid changes by losing 5 to 15%. It also increases HDL, the good cholesterol. Lungs. It has an effect on the airways. It has effect on your ability to breathe. One, because of the size. Number two, because of difficulty in taking deep breaths. And it especially affects people with asthma. Because of obesity, the heart has to work harder. And because of obesity, a lot of these patients have high blood pressure, which we'll talk about. And because of obesity, because the heart has to work harder, and because of hypertension, the heart muscle begins to thicken. And it leads to a kind of heart failure known as the heart failure with preserved ejection fraction, or HEPF. These patients are prone for acute development of shortness of breath, like a flash pulmonary edema, as we call it. Suddenly they get short of breath. If they increase their salt intake, they feel like they can't breathe, and that's related to congestion in the lungs because of the stiff, non-compliant heart muscle, where reduction of 7 to 9% weight can definitely help to bring down the blood pressure, bring down the resistance to the blood flow, and thus reduce the strain on this non-compliant left ventricle. Keep that in mind. Blood pressure. I mentioned about blood pressure in the previous slide, and let's talk about blood pressure. A modest reduction in 5 to 10% weight can show a reduction in the blood pressure about 5 millimeters in both systolic and diastolic blood pressure. I had a lady, I had to tell you, she was in her mid 30s, and she was overweight. She lost 100 pounds. She was on like 4 different medications for blood pressure. Eventually, I was able to take off most of those blood pressure medications, and she was fine actually without any medicines for her blood pressure. So if you drastically lose weight, imagine your heart having not to pump for those extra 100 pounds. And that makes a world of difference for a person who is trying to lose weight by any means, with diet, with exercise, with surgeries, whatever it takes to lose weight will have a dramatic effect on all these multiple system and organs which we have been talking about. Let's move on to women with obesity have increased incidence of polycystic ovarian syndrome. That is, just like we saw in the liver, where the liver tissue was replaced by fatty tissues, these patients may have like cysts in the ovaries, which reduces the overall ovarian function, leading to infertility. Joints. What can I say about joints? I mean, we have seen time and again in our practice. As a cardiologist, I mostly see older population patients. As I said, more than 40 to 50% of them are overweight. Not only are they having heart problem, not only are they having high blood pressure, they already have sugar problems. It's just a matter of time before they need a knee replacement or a hip replacement or both in some cases. Can you imagine putting 300 to 350 pounds of weight on your ankle joints? That joint is so small, and your heart size is no bigger than your fist. And can you imagine your heart trying to pump blood for 350 pounds of body weight versus 150 pounds of body weight? That means one heart is pumping blood for two people. Think about it. If you can reduce your weight by just 10%, you can begin to see a whole lot of changes. And this is just a process of evolution. If you continue to be obese, it's going to take a toll on your joints. The joints can only bear so much trauma or stress, and eventually they will end up needing replacement. So, ladies and gentlemen, what is the solution? The best part of this entire presentation is, yes, there is a solution. You can prevent this multi-system avalanche caused by obesity by modest reduction in your overall weight. As I said, for example, if you had 300 pounds, if you lost 10 pounds, for example, you can prevent diabetes, improve glycemic levels in type 2 diabetes. You can drastically reduce your triglyceride levels, improve your HDL, reduce sleep apnea. You can minimize the symptoms and maybe prolong the time before you need any surgery, or maybe you don't need if you lose 100 pounds. And of course, depression and infertility. All of these, you just need, none of these are requiring you to lose like 30 pounds, so 30% of your weight. The max maybe 15%. So if you're 300 pounds, aim for 30-pound weight loss, and you're going to see a dramatic difference. You're going to see an entirely new person, which most people won't be able to recognize, but more importantly, you won't be recognizing yourself with all the multi-system improvements you're going to see in a very short period of time. So what is the solution to this mad runaway obesity that is just affecting every system in your body from head to toe? There are two things. One is we have to reduce the calorie intake. When we reduce the calorie intake, then automatically, at least you're stopping one side of the equation. It's like a two-sided coin. So you're stopping one side of the equation by reducing the amount of calories to what your body actually needs. And that you can easily do by reducing your carbohydrates by 30 to 50%. At age 40 or beyond, we do not need any carbohydrates to survive. Maybe a small amount, you need glycogen for immediate exercise. But the body has only 700 grams of glycogen storage, whereas maybe 75 to 150 pounds of fat storage. So any extra carbohydrate is going to be converted into fat. So you don't want to load your system with carbohydrates. Then you're going to deceive the purpose of trying to lose weight. Use more salads, avoid snacks. And the second part is you want to burn the fat that is already in your body. The best way to burn the fat that is already in your body is with exercise. Continued long duration exercise. Start off with simple walking, 30 to 45 minutes. Even if it's broken down throughout the day, I don't care. As long as you're walking 30, 45 minutes, 10,000 steps every day. Just park your car at the end of the grocery store, a big grocery store, then you can easily walk your 3 miles within that period. And when you do that, you're going to see a dramatic difference. And here, I did it for experiment purpose. My weight was like 186 pounds, believe it or not. In 2 months, I brought my weight down to 171 because I got tired of looking slow, lethargic, and irritable, all these things. And I replaced with salad and grilled meat. Yes, indeed, you can do it. It is not impossible. And this is a full meal here. I got salmon, I got chicken, I got popcorn shrimp, chickpeas, turkey meatballs, turkey burger. You can have a turkey burger, homemade turkey burger. I have a separate video on this topic for you to know how to make a turkey burger Indian style with spices. Oh man, it is so delicious. I love it. And I can also have turkey burger for a change. Then vegetables. Replace all these things and get rid of these sodas from your vocabulary. That's the thing. So, ladies and gentlemen, this is a long-winded presentation on obesity and its devastating effects on every system in your body and how you can reverse most of them with just modest reduction of your weight by about 10%. Thank you so much for watching this presentation. I have taken a lot of time to study this topic and prepare this presentation. So hopefully, if one person gets benefit, just like I did, I feel I have accomplished my purpose. If you'd like me to prepare a presentation on any topic in medicine, please let me know in your comments below. I will do the research and bring you the information that is useful to you. So, ladies and gentlemen, I am Dr. Nik Nikam. I hope you have enjoyed this presentation. And as I said, we have numerous videos on public education with reference to heart and other conditions. In fact, there's a book I wrote on stressless mind and also heart healthy living. You can take a look at those. And I will see you in the next video. Thank you so much for your time.